welcome to this talk. I'm Hélène Bonneau-Chloup. I'm a data scientist at Elixir Health that I'm going to present in a few seconds. So first of all, what is going to be the subject of this talk? Is going to be about unlocking causal machine learning to transform women's health in fertility care. So, as I told you, first of all, who are we? So we're Elixir Health, a medical startup, and we are developing a clinical decision support system in which we are using causal machine learning. So we want to tackle a big fertility issue at Elixir Health. So the main context is that 1 in every 6 couples needs ART. ART means assisted reproductive technology, and it's because of deteriorating environmental conditions, and also the increase of the age of the first pregnancy. The ART journey is about 4 years, and the percentage of failure is about 70% at every try. So it's really a lot, and we want to get these numbers down. So our tool is powered by artificial intelligence, and the goal is to help clinicians make better decisions and personalize the treatment of infertile patients. So our goal is to optimize the IVF procedure, and we want to maximize the number of oocytes retrieved in an ovarian stimulation. So, for the more broader context about women in fertility care, so often they are underrepresented in studies. So in this big survey, we get the result that the median enrollment rate of women is about 41%, where it should be 50%, and it goes down to 33% for patients that are a bit older. And overall, pregnant women are not really included in RCTs because they were excluded from them until the 90s, and also because they are a bit hard to convince to enroll because they are scared of potential errors. So in this topic, we want to use causal machine learning to make it easier to, not make it easier, but to use causal machine learning to do artificial RCTs or not needed to do proper RCTs to get the treatment effect of a drug or a medicine in general. So what is causal machine learning? So it's a part of machine learning, obviously, and it's different. Here I'm going to talk about this part and not about deep learning, which has its own causal deep learning part. So it's more, I'm going to be more in an explainable machine learning context. I think you all know linear regression, forest, gradient boosting. They are quite common algorithm, and I'm going to talk about causal machine learning. We are going to use 3 main components that are data. So first of all are X. I'm sorry, maybe at the back you can't see, but so the first one is X, which are the covariates. The data you're going to use to explain the variable you want to explain. Then you're going to have the treatment T, which is the drug, and then the outcome Y, which is a variable you want to predict. So the idea is to isolate the effect of T, the treatment, on Y, the outcome. But it's complicated because both X, the covariates, and T, the treatment, have an effect on Y. So I'm going to do a quick, easy case to explain to you all. In the case of a binary treatment, so there is only one possible drug and 2 possibilities. First is T equals 1 means the patient takes the drug, and T equals 0 means the patient doesn't. And these are the only 2 possibilities. We want to obtain the treatment effect, and to get this, we want to obtain 2 quantities. The first one, is Y, so the outcome if T equals 1, means if the patient takes the drug, and the other one we want to get is Y, still the outcome, if the patient doesn't. And then we can easily get the treatment effect by subtracting the 2. Which means Y if T equals 1 minus Y if T equals 0. So in a more complicated context, I'm going to explain everything. So first of all, you have the outcome, as I just explained you, the treatment. So here it's about oocyte that we want to maximize, the dose of hormone you're going to get at the beginning of the ovarian stimulation, and then all the covariates. I put 2 examples, but we have a lot of them. And then what you're going to do is you're going to predict the outcome for each possible dose. here we have 6 possible categories of dose. For each patient, by that, you're going to have potential outcomes. So the outcome if the patient takes a drug 1, if the patient takes a drug 2, etc. And then you have all of them. But the thing you want to do is to maximize the number of oocytes retrieved. So you're going to look at all the possibilities, and you're going to take the maximal one. On the first line, it's 5. And then this prediction, you're going to call it the maximal prediction, and the corresponding dose, you're going to call it the optimal dose. And so by doing that, you're going to have a maximal prediction and an optimal dose for each patient in the whole database. Yeah, so once you have that, you're going to have results. But first of all, just a quick more explanation about what we are using as a data. So we are in an ovarian stimulation context, and so the outcome in the number of oocytes. And our treatment variable is the dose of hormone at the beginning of the ovarian stimulation, split in 6 classes. You have everything here. And we are using categories because first, it represents quite well what the doctor is doing in practice. And secondly, it's easier to get a treatment effect with a categorical variable. And also, we have various covariates. Then I just want, before the results, I want to do a quick trigger on missing values. Because in medical data, there are a lot of missing values. And sadly, often they are just deleted. But it's really bad because usually when you delete missing value, you create bias. Because, for example, if you don't check and all of your missing values are young, then you're going to have a bias. If you delete them, you're going to have a bias towards older patients, which are going to make all your results wrong. So, solution is quite easy. First, just do a quick study on the pattern of the missing values. Are 2 types of missing value correlated? Just do a quick study about that, and then use robust imputation methods, not just imputing by the mean. Do, like, I put you 2 examples here. So there is mice, which is multiple imputation by chain equation, which is one of the most common one, but you can also use some other, like FAMD, but just use a robust one. So, about our results. We have here 2 main types of results that we are using on a daily basis. So here, first of all, is a Sankey diagram. It's about the distribution of the dose we had in the base versus the distribution we have with the recommendation of the models. I will go back to this shortly. And then you have the dose response curve, which is easily all the prediction for each possible doses, just plotted how they are. Yes. So basically, you just plot all your possible all your possible dose with all the possible outcomes with all your possible dose. It's quite easy to get. And then here is just the dose recommended by the algorithm. By that, I mean the optimal dose I was explaining to you at the beginning for each possible patient. Here, this model recommends a lot the green dose, which is 150 to 225 international unity. Quickly about broader application. So you can have optimal prescription, as I just explained you. You can also have treatment outcome curves, and you could also have RCTs because there is another causal inference technique that is matching, where you can get numerical trends between control and tested group, where you could delete the random part in RCTs because you would numerically get numerical trends in your groups. And just to end it, a quick conclusion. So I explained to you mainly one approach of causal machine learning. I show you that you can have different types of results and application, like dose response curve. And I also explained to you, and also there are also causal models that exist that directly take into account the treatment effect, like the causal forest. These are the papers I used to do my talk, and here is my email if you want to contact me for questions, if we don't have a lot of time to do them, and the platform contact if you're interested in our solution that we develop at Elixir Health. Thank you. Do you have any questions? Yes?
I'd love to understand how you collaborate with hospitals. Now
Yeah.
that you've explained the model, how
Yeah.
you collaborate with medical institutions
So basically, we collaborate in two ways. Either we just deploy our platform at their hospital, and so we get paid, so first of all. Or the other way around is that we are going to collaborate for research, as we do in the Hospital of Strasbourg. And then we have the knowledge of the doctors there that can explain us why the data look like this, what we have these kind of results. And then we just do papers together. Yeah, and they help us grow, and we help them understand their data, so it can be one way or the other. Yeah.
Just one question. Maybe you explained it and I missed it, but why did you choose causal machine learning specifically?
Yeah, we choose causal machine learning because we want something explainable, and we want something that really takes into account the treatment effect that usually is a bit put under the carpet. So we really want something that shows why the patients are responding this way, and by that we are using the treatment, which means the dose of hormone, as the main leverage variable we have. I don't know if it's clear. Yes? Yeah. So the solution is really diverse. We are doing also some teaching things for the patients. We have really a lot of different fields. And for this particular field, we are doing for now only a dose response curve for the doctors at the beginning of the stimulation to help them decide by using a causal model which dose they should get for their patient that maximizes the number of oocytes, or we also let them decide which dose they should choose by looking at our results. And we can talk about more of the platform later on. Thank you very much.